The Attorney General's Initiative Award, honoring a county prosecutor's office or police department that exhibited outstanding community outreach efforts. The Attorney General's Initiative Award is presented to the Monmouth, Union, Hudson, and Middlesex County Prosecutor's Offices and RWJBarnabas Health for the Arrive Together Critical Incident Model.
In 2023, representatives from Monmouth, Union, Hudson, and Middlesex counties saw the need for a new Arrive Together model. In partnership, they formed a multidisciplinary team that included all 4 counties and RWJBarnabas Health to design a plan for what would become the 5th Arrive model. Only originally intended to be a pilot, it became a framework to improve the state's response to barricaded individuals.
Critical incident model represents an expansion, a logical expansion of the Arrive Together program that currently exists throughout the state of New Jersey.
A new way of dealing with those individuals that might be barricaded, decompensating, or having just a general everyday crisis. And we're coming to their aid in a different way that I believe is more empathetic as well rehabilitative.
And the fact that we have this opportunity to work with RWJBarnabas Health, mental health providers, that's tremendous. That really gives us everything we need.
These mental health consultants are individuals who have a master's level education. They have an understanding of mental health disorders.
They are on call 24/7, so that at any point in time, if there's a need for our tactical team to be deployed, and we certify that that is the case and we need services, we will call out to them.
The critical incident model is for our response team, which we call a SORT team, which many years ago was called a SWAT team. And so that response team does partner with a mental health professional when there is someone who's a barricaded individual.
Having these tools at the scene readily available, as opposed to having to call them in and wait for their availability, during which time these situations escalate, further tensions arise, as opposed to perhaps immediate de-escalation.
Let's go to the heart of it. Let's go to the core of it and try to figure out how can we help this person. It's so much safer for everyone, both the law enforcement and the individual that may be barricaded, that may be going through the mental health crisis.
Nobody's rushing in at the arrival to say, let's go in guns blazing. That's not what happens. Everything is very analytical, very calculated. The least amount of force that's needed or necessary to make a situation safe is what we're trying to do.
And we have seen very positive outcomes and want to see that continue and expand in New Jersey and throughout the nation.
The collaboration which led to the Arrive Critical Incident Model is one of many reasons why New Jersey is the national leader in not only alternative response programs, but also in law enforcement more broadly. Because of these county prosecutors and the assistant prosecutors, detectives, critical incident response teams, and their mental and behavioral health partners, they not only expanded Arrive Together, but they fundamentally changed how law enforcement in New Jersey responds to situations involving barricaded individuals. In doing so, we're working towards guaranteeing positive and safer outcomes for law enforcement and for the communities we serve.